pink eye cases, we're told, are increasing in KwaZulu-Natal. Residents there have been warned to practice good hygiene. Let's get you more on this phenomenon. Bring in Professor Alvin Munsamy, who's an Associate Professor of Optometry with the University of KwaZulu-Natal and joins us now via our video link. Prof, it's lovely to see you. Thanks very much indeed for making time. The KwaZulu-Natal government has already come out to say that cases have jumped from 161 or so to more than 1,000 in just 3 days. This is clearly very contagious.
It is very contagious, and good morning, and thank you for having me. I think that the press is doing a fabulous job in covering this topic. Pink eye is highly contagious for obvious reasons, just like how you would have the flu. And one of the main infective agents of pink eye is a viral cause. There are two types. But in this one, from speaking to the clinicians on the ground, it appears to be more of a viral type of conjunctivitis.
What's the difference, Prof, if you don't mind us asking?
So pink eye is a loose lay term that we attach to the medical word conjunctivitis. And the conjunctiva is a clear, transparent tissue or membrane that covers the white part of your eye, which, as you see in the picture, called the sclera, and it also lines your eyelids. And basically, if there's anything that irritates it or inflames it, you would get the manifestation of a red eye, together with other signs and symptoms. The two main infective causes is bacterial and viral. Viral spreads a bit more easier, but both of them are highly contagious. And there are various ways in which clinicians can detect this. In terms of the public, they would look at the eyes being quite red. They may even get discharge. If they get a watery, serous type discharge, that'll be more of a viral type. If they get more of a thicker mucus type of discharge, that'll be more bacterial. Those are just common signs to look out for.
Yeah, authorities are emphasizing hygiene, and I suppose that's the way around this if you do find yourself infected with pink eye. But before we get there, what are the typical causes? I mean, are people just not, you're using the right hygiene processes? We're told not to share pillows in some instances. It seems to me, at least from the outside, that you can inadvertently catch a pink eye.
Yeah, the causes is the spread, which is the infective agents, as I mentioned, which is the bacteria and the virus. And the reason it spreads is because of poor hygiene practices. And I think that the media and the newspaper print articles, the TV coverage is basically emphasizing the right terms in basically touching your eye, touching surfaces. It spreads because we're in close contact with each other. So environments that has lots of crowding, for example, if one person has it, they touch their eye, they touch a surface, somebody else touches it. So it spreads from contact, and that's why we're emphasizing hand washing and not sharing face towels and pillows, etc.
The person watching at home would have seen there on one of our straps, we've just announced that there were even more cases, I suppose, in the last 24 hours, 197 or so. At which stage, Prof, does this become an outbreak?
That's a good question. I think that on the 26th, that was the first announcement by the KZN MEC of the outbreak. The last reports, I think, was on the 3rd of March of more than 1,000 cases. I think it is at a level of an outbreak at this point in time. And I think that's why there is so much of media coverage, including the MEC of KZN going out and releasing information to beware. The outbreak comes from the lack of hand hygiene and common hygiene proper hygiene practices. And I think that to prevent it from spreading and turning it into a full-blown outbreak, we need to make sure we practice safe hygiene practices.
When we were in the COVID-19 pandemic, there were a lot of interventions, and I wonder how many we can borrow, at least from your expert advice. I mean, people who were sick, for example, were encouraged to stay away from other people. We already spoke about crowds being a contributing factor. But more than that, if you did have to be in public, there were measures hopefully you could take, wearing a mask or so. I wear glasses, and I wondered to what extent, if I were to be infected with the pink eye, I'd protect those around me because of the perceived barrier, if you know what I mean.
Yeah, you're quite perceptive there. Yeah, so the glasses does act as a protective barrier. So generally, patients who would have some sort of protection would have less chance of contracting the condition. However, if you have the pink eye and you wear glasses, you must make sure that you clean your glasses properly with proper detergents, etc. We've learned a lot from the COVID pandemic, and I think that the best one is the hand hygiene practices. And I don't know if you remember the washing your hands with soap for 20 seconds, etc. And then I think for this particular one, touching your eyes is the most important one, because that's how it spreads. But sometimes these pink eyes, if they're viral based, they may have what we call a systemic influence, where, for example, you would have the common cold or the flu, you'd have a sore throat or sometimes a temperature, and those ones we need to be worried about a bit more.
Yeah. Would you advise quarantine, or is that going a bit too far?
I think that if you're on medication, if you're taking the proper treatment and you're doing the proper hygiene practices, I think quarantine is not necessary. But I think that if you're not taking any medication and you're in the full-blown stages, until you seek medical attention, until the doctor sees you and he puts you on treatment, you should practice a little bit of quarantine, but nothing as serious as the COVID pandemic, where you lock yourself up somewhere for X amount of days.
All right, I think people will be relieved to hear that. Look, in the extreme, well, let me start with the minor cases. Hopefully, if you do contract the pink eye, it's just an irritation and you're able to get through it. But what is the worst case scenario here, Prof?
The worst case scenario is when you have extreme discharge and your eyelids get swollen and puffy, and if you start to lose some of your vision, that could mean that the strain is quite. There's a lot of pathogen in your eye. There's a lot of viri or bacteria in your eye, and we don't want it to spread to other parts of the tissue. It's highly unlikely with the common pink eye to reach that, but there is a particular strain of pink eye that we haven't noticed yet in this one. I don't think we've had where it would reach the point where it would reduce your vision. No?